Yes, we have Bob Koss. Bob is the father of Michael Koss. Michael is 38 years old, from Coquihalla, and he suffered a traumatic brain injury from a vehicle accident. How long ago was the accident?
The accident occurred on May the 18th, 06.
Okay, so that works out to be approximately
6.5 months.
Okay. To date, Michael has completed 34 hours of hyperbaric oxygen therapy. Okay, Bob, I'm going to ask you some questions. Why don't you tell us a little bit about Michael's history and perhaps a little bit about the car accident as well?
Certainly. Michael was on his way to do promotion for Molson's, the company he works for, and he was with his family, his wife and 2 children, on his way to do promotion in Kamloops. On their way on the highway, they had an accident, and subsequent to that, as you mentioned, Michael suffered severe head injuries. He was transported to the Kamloops Royal Inland Hospital. He was in the ICU unit for approximately 12 days. Subsequent to that, the doctors realized that there was no need for Michael to remain in the ICU unit. And of course, we wanted Michael to be in a hospital close to where he lives. So therefore, he was transported to the Royal Columbian Hospital, where he has been now for approximately 6 months.
Can you tell us about Michael's progress prior to hyperbaric oxygen therapy, and if other therapies were involved?
Certainly. Until approximately 5 months ago, while Michael was at the Royal Columbian Hospital, we did not see any progress or any signs of recovery whatsoever. He was under good care by both the doctors and the nurses. However, we did not in any way see any signs of Michael recovering from his injury, and therefore he was considered to be in a coma. He did not move and he did not respond in any way to commands.
So no moving, no commands, he was in a coma. Did the doctors say that they could help you out anymore, or?
Well, actually, approximately 5.5 weeks ago, the neurosurgeon who was looking after Michael wanted to have a family reunion. And so we all gathered, Michael's wife, my wife and I, and our son Dwayne, who also lives here in Vancouver. We all got together with Dr. Lee, who informed us that unfortunately there is nothing they could do for Michael at the hospital. And this, of course, you can understand, these were shocking news to all family members. I must add, however, that approximately 1 week prior to that, we heard about hyperbaric oxygen treatment. So therefore, we started doing research on the internet, and we were really shocked and surprised to see and to read the testimonies of people, patients like Michael, or family members of patients like Michael who had similar brain injuries and who had undertaken hyperbaric oxygen treatments and almost woke up. Some of the patients went back to a normal life. After reading all of these testimonies, we were then convinced that this would be the route or the road to take for Michael. As you know, the unfortunate part is that the medical system here in Canada does not yet recognize the hyperbaric oxygen treatment for patients such as Michael. So therefore, we had to undertake these steps at our own expense. When we were made aware of the possibilities of hyperbaric oxygen treatments, we made phone calls to a few clinics that are available here in the British Columbia area. And after consulting 5 or 6 clinics, one of them precisely, which is the Richmond Hyperbaric Clinic, really impressed us. We met with the owner, manager, Florence. We met with all of the medical staff, and we were really impressed with the care, the concern, and the professionalism of all the staff members. So on that day, we made a commitment to undertake treatments with the Richmond Hyperbaric Clinic.